Let's study about ulnar nerve. It is the most easiest and interesting nerve in our hand, in our upper limbs. So, what is the origin of the ulnar nerve? Let's see over here. The ulnar nerve is over here. It is it is originating from the medial cord of our brachial plexus. Let's trace it down. Medial cord like this. Okay. So, what is the root value of the median nerve, ulnar nerve? And there is exception, I said you, in the video of the brachial plexus that the other, there was the root value, there was the mnemonics M4 and U. All of the four M has root value C8 and T1 except U that have the root value C7, C8 and T1. So the root value is C7, C8 and T1. Okay. And let's see where it's applied to in our hand. Let's make a note. Origin is from the medial cord of brachial plexus. Okay, and root value is C7, C8 and T1. Where it supplies to? Does it supply to the arm? No, it doesn't supply to our arm because anterior compartment is innervated by musculocutaneous and the posterior compartment of arm is supplied by our radial nerve. In the forearm, does it supply to the forearm? What about the anterior compartment? We have seen that in anterior compartment, the lateral half is supplied by median nerve and the medial part is supplied by the only two muscles by ulnar nerve. That was the exception case, right? In the median nerve, which was the exception case? Two muscles, the FDP muscle, which one? The medial half, and the second muscle is flexor carpi ulnaris. What about in our hand? Does it supply to the hand? Yes, it supplies to the hand. Our lumbricals L3 and L4 as well as the thenar groups, hypothenar groups, hypothenar. There was exception from the thenar muscles, that was adductor pollicis, and all our interossei, the palmar interossei, okay, and the dorsal interossei. These all are supplied by ulnar nerve. Okay, so among 20 muscles of hand, the 15 muscle is innervated by our ulnar nerve. It is the dominant nerve in our hand. Let's see how it comes all over in our hand. Okay, so this is the distal end of our humerus and this is our ulnar nerve. It comes to medial and this is our medial epicondyle. This is lateral epicondyle of the humerus, and then it's come over here. We have one muscle, that is flexor carpi ulnaris muscle. Okay, and it will travel over here between two heads of the flexor carpi ulnaris muscle. Okay, and it enters into the forearm and it gives one branch over here to our flexor digitorum profundus, the medial part of the flexor digitorum profundus, the medial half. Okay, and then now we have this nerve have to go to the hand and supply to the hand muscles. So it have to travel. It won't go it won't go deep inside. It is the superficial nerve. Okay, it will come superficial to the flexor retinaculum and give the branches. Which branches? Superficial branches to which side? To the our little and the ring finger. Okay, that was the 1.5 finger. Okay, so palmaris, I said you, this is our hand. In the hypothenar group, the most cutaneous muscle is palmaris brevis, and it's got supplied by our ulnar nerve and the skin of the 1.5 finger. This 1.5 medial side of hand. Okay, and then the next branch is for our hypothenar group. Hypothenar. Then which muscle? All among the lumbricals, L3 and L4. And all interossei, the palmar and dorsal interossei. And adductor pollicis, which is the group of thenar muscles. Adductor pollicis. Okay, and adductor pollicis is the last muscle to which our ulnar nerve is inserting to. That's why it is known as the graveyard of ulnar nerve. Is it clear? So, let's see. This is in the arm region, then forearm, and in the hand. All the muscles are getting supplied by ulnar nerve in the hand mostly, except the thenar group, that is the 3 muscles, and the lumbricals L1 and L2. Rest other are getting supplied by ulnar nerve. Okay, let's see the injury. Where can injury occur in the hand? So, injury can occur over here, the upper higher lesions and the lower lesions. Okay, in the lower lesion, what it can be? It can be due to fractures. Okay, it can be due to this is carpal cubital tunnel syndrome. If there is any injury, this is the our cubital fossa. There can be injury. So cubital tunnel syndrome. Okay, next, what it can be? Over here, there can be Guillon's canal syndrome. Okay, so there is 2 type of injury in the ulnar nerve. First is a higher lesion injury. Okay, in higher lesion injury, there can be the medial epicondyle fracture. Okay, and then another can be there is 2 head of the flexor carpi ulnaris muscle, so their head can be compression of their head. Okay, and then so this can be the higher lesion injury. So in that, what will happen? All of the muscles in the forearm, that is FDP and FCU, will be get injured, and the all muscles in the hand will be get injured except the our which was supplying by median nerve. Okay, so what will happen? These function will get stopped. Okay, so what our lumbricals was doing? Our lumbricals was making this sign, right? At the metacarpal joint, there will be the flexion at the metacarpal joint, and there is extension at the distal interphalanges. And what our interossei muscles doing? Our interossei, in the palmar interossei, they do adduction, and the dorsal interossei, they do abduction. So these function will be lost. So because of that, the patient will have the less claw. Only L3 and L4 is affected. So you can see L3 and 4, that is bipinnate, yeah, bipinnate 1 get affected. So here only two of the finger is having claw. Okay, this is the sign of claw hand. Normally the function at the metacarpal joint is of flexion, but here you can see extension. See, and what should be there at the distal interphalangeal? There should be extension, but over here is flexion. So only second, third, and fourth lumbricals are affected. Okay, so at the higher lesions, there is less claw hand. Okay, claw hand. And if the injury at the level of the our wrist, you can say there is Guyon's canal over here from which our ulnar nerve is passing, or the laceration injury of the wrist. So in that, all the muscles of the forearm is spared. Okay, these two muscles are spared, and because of that, there is FDP is spared. Okay, so that's why here more claw hand is seen. Okay, so at the lower lesion, there is FDP spared. Because of that, you can see more clawing. Here is also clawing, but there will be less clawing in the upper lesion. Okay, there is a term, ulnar paradox. So in that, in the higher lesion, there is less clawing, and in the lower lesion, there is more clawing. If the patient comes to you with this sign, claw hand is a classical example of ulnar nerve injury. Okay, so what we have learned, we learned that the root value of our ulnar nerve is C7, C8 and T1. It arises from the medial cord and supplies to the arm and hand. In the hand, it is the dominant nerve, and in the forearm, it supplies only two muscles, FDP, the medial half, and the FCU muscles. Okay, it start to the in the axilla, come along with the brachial artery, and it get posterior to the humerus. Okay, and then comes and go to the medial epicondyle, and then come to the front part of the forearm, and entering to the forearm how it enters to the forearm, it will pass between the two head of the flexor ulnaris muscles, and then supply to the FDP medial half. Okay, and then it have to go to the hand. In the hand, it won't go deep to the flexor retinaculum. It is superficial to the flexor retinaculum, and it's supplied to the superficial and the deep branches. In the superficial, it's supplied to the palmaris brevis. Okay, and the 1/2 medial side. And in the deep muscles, it supply hypothenar lumbricals, that is L3 and L4, or enterochoi, and lastly to the adductor pollicis. Adductor pollicis is the last muscle. That's why it is the graveyard of the ulnar nerve. And then we have learned about the injury of ulnar nerve. In the higher lesion, there can be the because of medial epicondyle fracture, and because of the head, there will be compression of the flexor carpi ulnaris, compression of their heads. Because of that, all the muscles in the hand will be paralyzed. That can be forearm muscles, and there can be hand muscles. All the muscles is paralyzed. That's why there is the claw hand. But it is the sign that in the higher lesion there will be less claw hand. Okay, only third and fourth finger is seen with the claw hand. And in the lower lesion injury, because of the muscles in the forearm is spared, and the muscles in the hand, total muscles in the hand, that 15 muscles, are paralyzed. Because of that, there will be more clawing, and that is known as ulnar paradox. In higher lesion, less clawing is seen, and in the lesser lesion, there will be more clawing. Okay.